Hi, I'm Cary Kaufman. I'm a breast surgeon, and I've been part of NQMBC for many years. In 2002, we decided to have the NQMBC. We thought a quality program that could assess breast centers and look at the entirety of breast centers to see what kind of work they were doing, what kind of actual care they were giving. Not whether you had radiologists there, but how well the radiologists did, how well the surgeons did, how well the integration was, how were patients given the proper kind of treatment at every step along the way. So in 2005, we came up with the NQMBC, and it's taken us a long time to get it just right, and we're still working on it. But the NQMBC has really been, it stands for the National Quality Measures for Breast Centers, has been a foundation program identifying the quality of care for breast centers. Now, other programs have occurred in the meantime, and I've been involved with some of those. The NAPBC, the National Accreditation Program for Breast Centers, is a program of the American College of Surgeons, and it works not in conflict, but in concert with the NQMBC. The National Accreditation Program for Breast Centers, NAPBC, is much more assessing the structure of care. They evaluate whether you have all the components ready to provide the care. And the NQMBC looks at the kind of care you provide with that structure. So they fit hand in glove. And so when people say, well, which should I participate in, the NAPBC or the NQMBC, it's really both. Because the NAPBC is looking at structure, and the NQMBC is looking at process measures. Process measures. How well do you do the job that you do? And so we have the NQMBC has been there since 2005, and we've needed major improvements. We need to make it easier for facilities to abstract the data. We need to make it easier to understand the measures. And we have really been delayed in getting that done, but we're getting it done now because we have the support, we have the the know-how, we have a website that's new and improved, and we're continuing to improve it, and we have a great idea about the future of the NQMBC. And so we're really excited about getting the NQMBC where it needs to be to facilitate abstraction so you don't have such a tough time getting the data out, so the measures mean something. So they fit right into your cancer registry, they fit into your mammography reporting software, so you can have the data back in and get it out and get it to us, and so you can compare yourself with other centers. One of the greatest things about NQMBC, it gives you real-time comparison of how you are performing with other centers. And centers just like you. If you only see 100 cancers per year, then you can compare yourself with that. You don't have to compare yourself with a center in the East Coast that sees 600 cancers a year. And the other question that we try to have looked at is what makes a good measure? Are our measures really hitting the target? Do they hit do they hit quality? Do they really assess quality, or is it a measure that you can just measure? And to have a good quality measure, it has to identify something that is important to you. It's important to patients, and it's important to your discipline. The second thing, there has to be some variety of exercise. The measure. I mean, if we ask how many people have a mammogram before a breast cancer treatment, it's going to be 100%. That's not a good measure. But if we ask, in what situation, we can ask a variety of things. I'm not going to go into it, but there has to be some variation in care. And the other thing is that really the biggest thing is for the NQMBC is, can you get the data? Can you abstract the data from the content that you have? You have cancer registries, you have mammography reporting software, you have surgical records and charts. We need to make it easy for you to get the measure and the information out of those programs. So we are facilitating the integration, the network that we can get you, whether it's the cancer registry or mammography reporting software, where we can make it easier on you to answer those measures. The last thing I want to talk to you about that is impressive to me, is the NQMBC isn't one program. It's the base of many programs. We've already developed the NQMBC Surgeon. The NQMBC Surgeon is quality measures just for breast surgeons, those measures that are important for breast surgeons. And that's just a step. It's going to be breast surgeons. There could be medical oncologists, radiation oncologists, plastic surgeons. Well, there are other things for those disciplines. But we also have not just NQMBC surgeon, but in the future we're going to have NQMBC facility. NQMBC, let's say Kaiser, or a variety of networks. Maybe a hospital network wants to know how their hospitals are doing. Well, we can have a individualized NQMBC program that just looks at that network. We also have it for international. If you are in Europe and you want to see how you compare your care with care in the United States, you can participate in the NQMBC. So I'm just really excited about the NQMBC. We have a past. We've had a slow run for a while, but we really have a great future because we have the IT expertise and we have the professional expertise to make us great. So I'm real excited about the NQMBC. It's a great program that looks at process measures, the kind of care that you actually provide in breast centers. It fits hand in glove with the NAPBC, which looks at structure, and the NQMBC that's looking at process, who the players are and how well they work. We have major improvements due to the support from the NCBC, improving our website, improving our work on the measures to improve the ability to facilitate abstraction of measures. And we're developing new programs, not just the NQMBC, but the NQMBC surgeon, the NQMBC hospital facilities, hospital networks, so individual hospital networks can look at how their members participate and how well they perform. So I'm excited about the NQMBC. So join us.